Oh, yeah, you're doing good. There you go.
There, that was
beautiful.
nice.
Need to be upright. We need to fight for your right to party, to stay upright.
And I'm thinking
Okay.
it's, oh, I didn't know you were over there. I'm thinking,
Well, let's just give me everything that's going on. So you have the hips and everything.
SI joints are usually like somebody at one guy I went to, he'd have me go like this and he'd feel,
Uh-huh.
and then he'd say your SI joints, but he never could adjust them properly, so.
Okay.
Anyway, that's an issue. Both shoulders, this one's worse. Sometimes if I try to exercise, like do the wall, between the door
Mhm.
for my mid-back, then it causes my shoulders to hurt.
Headaches? How often do you have headaches here? You see noted headaches.
Well, last night at 1:15, I woke up dizzy with a headache, and I was awake with a throbbing headache all night
Mhm.
until 5 this morning.
Mm-hmm.
It's not often that I get headaches like that, though.
Is there anything going down your arms? Any
Nope.
symptoms?
No.
Nothing going down the arms, just the right leg, and then it goes down the left leg?
Yeah.
Okay. And how long would you say that's been going on, that specific symptom?
A long time.
Okay.
I mean, I've had like pain, hot burning pain, like
Yeah.
in here. I mean, it's
Okay.
a long time.
All right, so we have some x-rays.
Very tight hamstrings, sloppy neck. I mean, I usually have problems with C1 and 2. I've been told it's like picking a lock, whatever that is. And so then the rest of it, though, when my head hurts, I try not to self-pop, but if I move it enough, then I can make it quit hurting a little bit.
And that pain that you're saying, it hurts where? Where's the most pain when you can get it to relieve? Is it just neck pain?
Yeah, it's like,
Right at the skull there, right at the top?
Yep.
Top of the neck. Okay.
yeah. And the accident was 50 years ago. 4 years I started going to chiropractors, and I've been to a lot of chiropractors.
Okay.
I mean, a lot, but I haven't been to anybody that does more than pop me for 5 minutes and then I'm gone.
Okay. With everything that I'm seeing here, what I want to go over in a basic way is that I treat posture. I believe our posture determines how our spine ages and the ability for the wires that leave our spine to be pressured. And what you have in many scenarios, your lower back, your lower neck, and there's evidence of certain discs aging faster. So all the discs in our spine are the same age. And on your reports, it talks about C4 and C5, and it talks about L4 and L5, and certain discs are older than you are, and they don't talk about the discs that are younger than you are. And those are the ones that I actually want to focus on, is answering the question, well, how are some of the regions of your back not injured, and why are some regions over-injured? Because they're the parts that are doing all the work. And so our posture determines which vertebrae are the ones that are most utilized. And so you've been through, I know you had a Denerol and you've been working on that, but maybe not enough care to properly utilize it.
Direct me.
I'm going to know when I'm working on you in a minute how to guide you on that Denerol. If the spine is overutilized in the lower neck and I ask the spine to stretch, unfortunately your neck is only going to bend where it's already bending, where it's already injured. And the Denerol can be a little bit not the best tool to use in that scenario. We want to get through a series of care where your spine is clean, where it's moving properly, and then the Denerol becomes like a retainer that just holds it. It doesn't have the power to get things moving if they're frozen. And so my job is to see how your spine's working, if the spine is limber where it should be limber, and then we'll make a decision if we want to stretch or not. But let's just go through the spine. The upper cervical is your main engine. It'll tell me how well this is working, will tell me how much stress the lower neck is under. How tight the middle back is tells me how the lower back is doing. The groin pain is really from the SI joint. So I know that you said they were evaluating the SI joint. That's what gives you that pain right here. Mm-hmm. It's a dysfunctioning or inflamed SI joint. And then you have a level of nerve pressure coming from lower back that's giving you those symptoms down the legs. So we'll see if we can move some stress off the lower back. My dad was injured by care that focused so much on his lower back, so I'm sort of hesitant I don't touch people's lower backs. In my 18 years of practice, I kind of stray away from touching that area because that is where all surgery happens. And so we work above and below, SI joint, middle back. We'll try to distribute some pressure off the lower back. Your middle back should feel
Wow.
supple.
Yes.
Right? I don't walk around, hi, how you doing today, guys? You understand? Tight core. Yeah, just super tight. You understand?
Yeah.
This is where I live, right?
Wow.
But if I live with this is just normal for me. This is how I stand. I'm not just jacked core all the time, thinking I'm gonna get in a car accident, so my body's gonna be getting, just in case I get punched. Does that make sense?
Yeah.
So I want a supple core, because if this part of my back is supple, when I bend, my whole spine's gonna work. But if I got this all tight and I go to bend, do you see how this is just gonna do all the bending?
Yeah.
And you do that for 50 years, we're gonna wear out the tread. These discs represent tread like on our tires, right? And then that's what they're talking about in those reports, you've thinned out the cartilage, and you see how that is a hole with a wire going through it. So as that disc becomes more narrow, the hole becomes more narrow, and now we're hitting wires, and it's weird. It starts here, and it depends on which part of the wire you're hitting, but you're hitting nerves in our lower back. What's happened is your shoulders are a little rounded forward. So because you said you have these shoulder pains, many times our shoulders hurt. Here's what I see going on. It's the ear hole should be lined up with the shoulder. Your head is forward, but the shoulders are forward, so it still lines up. See, it's lined up, Ed, yeah, but if I pulled your shoulders back, do you follow me?
Yeah.
We would see the forward head posture. So, but having the shoulder in the alignment that you're in, like your shoulder belongs more back here, makes sense? And that would show you about 1 inch forward if I retracted your shoulders. When you use your shoulders in this alignment, it's gonna hurt. It's
Kind of hump.
right, I understand, but my point is that when you were saying earlier you were doing exercises and you feel shoulder pain, that's coming from the fact that your shoulders aren't where they belong.
I was trying to do that, and then like that, you know.
Okay. We want to stretch it back. I'm going to show you at the end of the visit. We have to. It's not a active exercise to relocate your shoulder. We have to take time and actually stretch the pectoralis over a period of 10, 20 minutes, and actually stretch the pec to relocate the shoulder. Rotator cuff labral tears will happen in the shoulder if you keep the shoulder in that position, and then especially if you exercise the shoulder in the wrong position. The humerus sits in the middle of this cup where the tread is deep, like a lake, and when your shoulder goes forward, you start to ride on the lip of the joint, and that can cause a lot of shoulder pain.
Let's see. VBP.
BPPV, yeah, benign paroxysmal positional vertigo.
But most recently, it's acting different, so I'm thinking maybe I'm getting some neck
Who
dizzy.
told you you have BPPV? How did this get diagnosed?
I went to a chiropractor that used the drop table thing. On the 17th visit, on the table, it just started going wild. So then I went to the Silverstein Institute, and then they...
Say you have crystals in your middle ear?
Yes,
All right,
they did the Epley.
They did the Epley.
I know how to do it myself now.
Okay, you did the upside down,
Yep.
45, rotate.
Yep.
And do you get sick while you did the Epley? Can you tell me about what it feels like when you did the Epley?
Depends if, well, for one thing, my eyes are just like, whoa.
Going crazy while you're doing the
And when
Epley?
that happens really bad, then of course I get nauseated and sometimes, I get sick. Recently, in the last couple of weeks, I've been waking up and I can tell by my smoke detector that it's going round and
Things are moving.
round, but I'm not getting sick.
How many times have you done the Epley, and did it change a lot after you did the Epley?
It changes every time I do the Epley if I do it long enough.
Okay. All right.
And sometimes I think, you know what? I don't want to get sick. I'm just going to ride it out and not turn my head. And so sometimes I don't do the
Yeah.
Epley probably when I should.
There's a lot of overlap. Even your desire to do that is pressure here. I know. It's okay. I'll fix you. Cross these arms for me, real gentle. Yep. Little sit up for me. I'm gonna help you. Take one deep breath in, and just relax your chest. I got you. Good. There you go. You did good. Deep breath. I got you. 2 more. There you go. I got you. There you go. Oh yeah. You're doing good. 1 more. There you go. Last one. Good. Okay. Doing great. Stay there. Yeah. All right.
At least that moved.
Some apprehension, right? Get the idea those joints have some qualms with being told to move. And we want that to be effortless. I'm gonna go little baby adjustment, okay? Little baby adjustment, real gentle. I got you.
Okay.
Not gonna hurt
I usually try to tighten up.
you. You're fine, real gentle. I'm not gonna hurt you. So,
I tap my fingers and that makes me,
yeah, you're good.
when I tap my fingers, it makes my concentration not beyond.
We're not trying to pop every bone. You did great. We're not trying to pop every bone in your neck. We're just trying to loosen the atlas. Very, very gentle. Easy, easy. I got you. Let it go. There you go.
There, that was
beautiful.
nice.
Yeah, yeah. I can tell you've been adjusted. There's those joints have been worked on. Actually, very, very young feeling joints up here.
Well, that's a good thing.
Yeah, nice and supple. We gotta just, but it's like habits, you know. You
When I
kids.
sit in the recliner,
Mm-hmm.
I don't care if I try to put something behind my neck or
Mhm.
not, I get up and it hurts.
Yeah, we gotta throw away the recliner. The recliner.
Ugh.
All right, so all of a sudden you are now CEO of the recliner company, okay? And so how do you sell a lot of recliners? By making comfortable recliners while people are sitting in them, or
Yeah.
make uncomfortable recliners while people are sitting in them?
Yeah.
You make comfortable recliners while people are sitting in them. And what defines comfort? Well, a recliner that puts all the weight on the sensitive parts of your spine, or a recliner that puts all the weight on the non-sensitive parts of your spine.
Now they have them with the button at the head.
Do you see? Right?
Horses.
So they put you in a really crummy position, right?
Yeah.
For like standing, for like walking around, but a really great position to live in the recliner. To the point where I'll have people come in here and tell me, I sleep in my recliner. I love my recliner. And I don't immediately tell them, but my thoughts are, how messed up is your back that the recliner is the only position that you can get comfortable in, right? That I need my chair to support me and hold me in my avoidant posture, right? Not good, not a good place to be. We need to be upright. We need to fight for your right to party, to stay upright, right? We have to fight to stay upright. It is difficult. The adjustments are simply tools to make the spine limber so that our posture can be aimed in the right direction. I don't treat symptoms. And one person might say, well, you know, your care looks similar between patients, and the answer is correct, because I don't treat her symptoms. I treat her posture. And in order to treat posture, we have to make the spine ready and willing to accept a new posture. And not even really a new posture, but the posture that you used to have pre-injuries. You know, pre it changing, the posture you had when you were a child that we left because of injuries that then caused your body to go into an avoidant posture.
I'm not so sure as a child I was that well because
Oh,
they
great.
took me out of the womb with paddles.
Well, they
With
got you
forceps.
forceps, saw tongs, right?
Yeah.
Well, so injuries might have been sustained right at birth, right? Just coming into this planet. You got, my parents were both forceps babies, and
That was the day.
yeah. So there's going to be lingering tightness because you didn't have my father, Dr. Bo, as your father.
By the way, he's kind of scary.
Oh, he is scary. Yeah, yeah. I know.
I'm like, oh my gosh.
I know all about what my dad does. Exactly. He's my only chiropractor. Okay. I mean, my brother and my sister work on me sometimes, but you know, yeah.
When I saw him do you, I'm like,
Uh-huh. My favorite is in Star Wars, you know, when Luke Skywalker tells Yoda that he's not afraid of the dark side, and Yoda goes, "Ugh, you will be." So people say to me sometimes, "I'm not afraid of your father," and I go, "Ugh,
you will be.
you will be." That's only because you don't know. You haven't.
I mean, he's so direct, like.
I know.
Oh, and the other funny thing I wanted to tell you about the YouTube thing that I watch you guys.
Mhm.
Your daughter,
Uh-huh.
I guess maybe the oldest one,
Uh-huh.
and you were acting like you adjusted her nose, and I go,
Yes.
oh my gosh, she can adjust my deviated septum.
I know.
And then she did it.
We're goofing around. I know.
I realized that
I
into the
know.
video.
Oh, you watched a lot of them if you know
I-
all that. That's
I
fun.
did.
Aw.
There's no normal soreness. There's no normal tightness, right? There's just injuries and bad posture and the effects of such, and we have to work through all that. Yeah,
Well, I'm excited to do my part.
yeah, you're doing good. You're doing great. We'll get it all.
I mean, like at home.
Good. Yeah, I'm gonna say we'll go over that at the end of the visit. See if we can. We're really just trying to retain this, right? It's just that they made a piece of foam, and if you want to know the intent and purpose is to do this, to just hold you in this curved position. Now, yes, ideally, I just hold your neck like this, but I can't do that. So we give you a piece of foam that emulates my hand, and it gives you a way to hold the neck in the curved position. Your posture is a distillation of whatever position we're in the most amount of time. And so we need to counter stretch you and have it bend, not in the lower neck, not where it's injured. This is the gua sha. So there's already a mark on that left side, and that mark illustrates the tightness that I felt, right? It's an outward visibility of what I feel inside, which is the tightness which is not just muscular. The joints are a little bit tighter than they're supposed to be, but the muscles, when they're contracted for long periods of time, will build up lactic acid. And we'll see that lactic acid as a mark when we comb the tissue and you bring blood in there. You'll see, I mean, I'm going really gentle on you, right? I mean, it's not that, not digging that hard. It's not bruising you, but what inside, there's lactic acid that's accumulated. Have you had any fascia blasting or
I've had
cupping
myofascial release.
but no combing like this on you?
No,
Nobody's
no.
ever gouache.
Just the guy, the physical
Interesting.
therapist did a lot of, I had it, the acupuncturist, the cupping,
Cupping, okay, cool.
just up and down the back.
That's a similar effect, but we're just trying to increase blood flow. So the tissue should be self-cleaning. Ultimately, that's all based on the posture and your mobility.
I know you said to somebody, don't use heat, but heat makes my neck feel better.
Heat, you want to put heat on the areas that are stiff. So the upper neck,
Yeah, that's
wonderful.
how I put it.
Just no heat on the lower neck.
Oh.
So the parts of your spine that are already inflamed, we don't want to put gasoline on the fire.
Okay.
Parts that are already stressed, we don't want to pour more heat on them. So we heat the upper neck, we heat the upper back, middle back, no heat on the lower back.
Okay.
Right? The parts of your spine that are already upset, swollen, inflamed, we don't want to put more heat on them. That'll just further inflame them. The left side of your back is more elevated, and this is why it goes down the right leg, and then either you compensate or you adjust how you're walking. When I feel your back, the left side is probably at least a quarter inch, I don't know, half inch more raised.
Really? Because it seems like the rib's out on the right.
Well, you're going to abuse this side, but you're avoiding your left, and you're going to abuse this. I mean, it's very easy to see, at least from my... I work on backs all day long. This is all popped up right here. This is all lower, and she's all right here. This is the most elevated part of your back. This will throw the work to the opposite lower. So the right lower back, the right hip, right leg is going to be under more stress. All right. It's all right in here. This is where we want to put the dental. There's a lumbar dental or my sister's roller. We're going to use it right in here.
Okay.
And see if we can teach you how to use that as like a toothbrush. And you go in here. Too much pain, you okay?
Oh, no, I'm
Okay,
fine.
if I'm going too hard, please let me know.
I can usually take it pretty deep.
Okay, I'm learning you today. If I ever go too hard, please let me know. But yeah, right here, we want to emulate my elbow.
Yeah, that spot right there.
You got it. Thoracolumbar junction, left side is your most restricted area. Right there is the root. And it's not a coincidence that I'm right over the strap of your bra. Right, so
Right.
we're right. I can still see the dents in your skin, but that's, the culprit is that this area is allowed to bind up.
So all the hippies of the 70s that went
They had the
without-
right idea. They were burning them. Amen.
And I've been to other chiropractors where I had to wear a neck brace for 48 hours.
Okay.
I mean,
For treatment or because
yeah, after they adjusted me, I had to wear a neck.
Lord have mercy. Something wrong happened.
because they hurt you or because
No, because
oh,
that was their protocol.
Her protocol. Okay.
interesting.
So I mean, I've been.
That's weird.
See, you're not allowed to. See, I don't want you to be stiffer after I adjust you. Putting a neck brace on is something we use if we have something severely injured, right? If somebody injures their lower back, I'll advise them to put a back brace on the area that's injured. We never put a back brace on the area that's young but frozen, right? And in the neck, it's not possible to just brace the lower neck. You're going to be also stiffening the upper neck. So again, if we have to because I'm in so much pain and I'm dying here, then fine. But
No, it was just part of his protocol.
that doesn't make any sense to me. It's like
And that was the same doctor that put me on the dinner roll.
this is because they found within 10 days of a joint not moving that it becomes frozen. Very quickly, when joints don't move, they become locked down.
It's really nice to know because it's motivating to keep your exercises up at home.
Very quickly. Yeah, it doesn't take much time. You take 2 weeks off or 2 weeks of immobilization, your shoulders are frozen, your back's frozen. It does not take months or years. 10 days, joints can become frozen and locked down on you. And so they lubricate and clean themselves through their mobility. So they're like self-lubricating like an engine. It's like a car engine. The oil pump is pumped by the engine running, right? It lubricates itself by running. So when the joints don't move, they become frozen pretty quickly. And so this region right here is your cause. And so I know everybody's trying to manipulate this and trying to, adjust your lower back. I would leave that area alone. I'm going to work below the lower back in a second.
I haven't found a chiropractor in all these years in Florida that can adjust my hips.
Right, we'll check in a second. The goal is to adjust the SI joint without adjusting L5, right?
I've watched you do that.
Right, so we want to, there is benefit to loosening the SI joint, but not if it is at the cost of upsetting L5, which we already know is injured. I have your MRI report. So why put more stress on the parts that are already overstressed? And maybe we spend a handful of visits just doing soft tissue, putting some WD-40 on the joints, getting them lubricated so they can move independently, and then we can actually get them to adjust safely without manipulating every vertebrae. Right? We're not trying to manipulate the spine. We're trying to adjust certain sections and not adjust other sections.
I actually thought that elbow thing would hurt worse, but it doesn't hurt at all.
Not too bad. Good.
Because I always thought that would be really painful, but
She's tough, man. She's tough. I just worked on a guy earlier in his 20s, man. He was doing good.
well, I don't know if I'm tough. I've had an acupuncturist told me that it's hard to find a pulse and I don't feel the needles go in, so I don't know what that means.
Sounds like
You're a vampire. I take it nobody's really dug in here hard?
No.
Yeah, okay.
Even the let's see, what's it called?
Uh-huh. See, they're all focusing.
Neuromuscular massage.
See, all the prolo guys, all those guys, they're focusing on the injured areas, right? But the injured areas didn't do anything wrong.
Well, this guy also told me not to have any chiropractor adjust me without the activator because I'd be stretching the ligaments that he just tightened up with the prolotherapy.
No chiropractor should adjust an area where there's injured ligaments. Do you understand?
Mm-hmm.
So if he's trying to tighten a ligament, so be it and thumbs up. But we're not trying to, if a ligament's hypermobile, right? If the joint's hypermobile, then the ligaments that support that joint are also stretched out. There's no benefit from an adjustment that further loosens an already loose hypermobile area, right?
Mm-hmm.
So I guess he's correct, but that doesn't mean you don't get adjusted. It means that we need to be particular about where we're adjusting you. That's why we say the word adjustment, not manipulation.
Mm-hmm.
If you're just being manipulated and we're not being decisive about where the forces are going, then he's absolutely correct. Then you're not allowed to be adjusted. The areas, but if you leave prolotherapy isn't changing the reason for why the ligament's hypermobile. You follow me? Because that's the only part
Well,
of
he
your.
says that it's like a sugar solution that when he injects it.
I understand. Fair enough. Let's say it does tighten up the ligament. I'll grant that. However it works, I'll grant it. You didn't change the reason for why it got loose in the first place.
Oh yeah.
So it doesn't matter. It doesn't matter if I grant that what he's saying is possible. You didn't change the posture. You didn't change the mechanics. You didn't take the stress off that area and unlock her middle back, unlock her upper neck, put the curves back in her spine so that those ligaments that are stretched out and injured don't just get re-stretched out again.
Mm-hmm.
Surprise!
There's a spot right there that is.
Oh, I found it. Okay, I'm learning you. These are
What
the
is
roots of your
that?
neck. The roots of your neck. These are the
Oh.
roots of your
Oh.
neck. So when you tilt your head back, you're compressing all these structures back here, and you're feeling them. That's why you notice them. That's the opposite of what the recliner does, which helps you avoid them. Now you're confronting them. My goal is to clean all this so that when you bring your head back, there's not all this filth and dirtiness in here that you didn't notice.
Mm.
It's like, that's a problem. Fix it, doctor. Yeah, right there. It's nothing not right.
Then I've quit eating certain foods because I think, okay, maybe corn's causing inflammation, maybe sugar's causing inflammation.
That's not a bad thing to think. You're right. You should cut back on those things, but you have a mechanical problem,
Yeah, exactly.
and you fix mechanical problems mechanically.
Yep.
Now, if it was completely a dietary problem, you're right. Those aren't bad things to do. But I feel mechanical problems here. Mechanically, this part of your back is underworking. Mechanically, these attachments and muscles are, knotted up and frozen.
So interesting, in '93, or, well, it happened before that, but I was poisoned where I work
Uh-huh.
with aluminum, mercury, cadmium, and lead. And then 7 neurotoxins were found in my blood. So I began the journey of learning how to
Detox.
detox and, try to survive.
Gotcha. I'm sorry we haven't been guided through this. been shown, but this is what I was trying to say earlier, right here. I can see the lines, this is where it's all frozen. And the lower back is just reacting to your.
Well, I'm just glad you're doing it because I've told this to so many people and they go powers on or they go whatever they say.
I got you. No, they're.
And they, like the last one,
I got you.
she didn't want to adjust me because she thought that it could break my bones or something.
Lord have mercy, they got them so scared. Oh, Lord have
And
mercy.
so I'd say, it's still frozen, could you do it again? No, I can't do it again because she says, you'll hate me tomorrow.
Oh my. This is where I pull out Yoda again. Fear is the path of the dark side. Fear leads to anger. Anger leads to hate, and hate leads to suffering.
And then I've watched you when you adjust somebody and their head won't go anywhere. You know, it goes like that.
Right.
Well, when that's happened to me, I go, no, I didn't do it. Can you do it
Do
again?
it again, right? Work it.
And she, no, we can't do it again.
Get to work. Work the joint, massage. Like I told you earlier, we're working up a ladder. Every visit is a stepping stone up the previous visit. This is an investment. I'm investing in next time I adjust you right now.
Mhm.
This is I'm going to reap the rewards of this a few days from now. You understand? Then we're going to get, oh my gosh, that moved even better than it did the first time. Correct. We'll do it again. We're going to keep doing cycles of carpet cleaning until there's no more stains, until there's no more black and blue coming out of the carpet.
Yay.
We shut this down. We make this part of your back the main engine. You forget the lower back even exists.
Mm.
Your middle back needs to be what's drawn from here on out, not your lower back. I'm not trying to inject or do something. Your lower back will calm down when the burden that it's carrying is relieved off its shoulders. That's what makes your lower back and leg feel better. Here we go. Oh no, not the butt head. Anything but the butt. There we go. So we're going to loosen up this joint. Before I adjust you, we're going to try to see how willing, right here, that's the top of the SI joint. Again, there should add.
And I'm thinking
Okay.
it's, oh, I didn't know you were over there. I'm thinking it's
Yes, ma'am.
somewhere like that. I thought he was on this
That's the
side.
top of the joint. There shouldn't
Oh,
be
yeah.
any tenderness. We want to get to a place where Ed is, push harder. There's no normal tenderness in this joint.
Okay.
That's our journey. That's our journey. I'm like a Sherpa to Mount Everest. I can't carry you up to the top of this mountain. I'm just a guide.
I
just-
can take it.
I just guide people. One foot in front of the other. Let's go. Yeah, you put heat on this SI joint. You put heat here. Unlock. Just mainly the lower back and lower neck are the two areas I'd like to try to avoid heat.
Okay.
I don't want to, but you can lose heat on this joint to help me unlock this joint a little bit.
Okay.
Now, when we take things that are frozen and get them moving, there's going to be a level of apprehension or, saying some soreness that we're not going to notice until those areas have been unlocked.
Mm-hmm.
So you have to kind of work with me and hang in there with me as we unlock these frozen areas and you start to feel areas that haven't been working start to work again. Does that make sense?
Mm-hmm.
Just trying to give you a forewarning. I got you. Breathe. Exhale. I know. We're trying to make this upper back bend more. Good. Breathe for me. Exhale. Good. Other side, huh? Beautiful. Get the idea?
Yeah.
Yeah. It's
It
good.
didn't move much.
No, it was our side joint. That's all I wanted.
see. Yeah,
Outside.
a little bit of.
Little bit spinning.
moving.
A little bit.
Now they're stabilized.
Okay. I'm just trying to move it middle back here. Good. And now we're going down here. Exhale. Uh-huh. Here it is. It moved.
Yeah, that was a mid back too.
No, that was here. That was right here.
But I also felt something there.
And up the middle back. Good. It's all. You did great. Let me have you just lay on your back. Go easy. Okay. I got you. Oh, okay. All right. Don't take my toe off. Don't take my toe off, Ed. All right. Fair enough. I'm just greedy. Easy. There you go. Nice and loose. Okay. There we go. I know. Okay. There we go. Try to be sneaky. Okay. Come on, joints. Uh-huh. There you go, good, nice and loose. Right. So,
Wow,
right,
yeah.
Get the idea what we're dealing with? Not normal.
Mm-hmm.
That left side is, like I said, the straps, you almost can still see them a little bit there, but the point is this is all jammed up. And your poor lower back is the only part that's doing all the work. Come on, breathe.
I can do that.
Too much?
I'm thinking it would be up one
Uh-huh.
little higher.
That's where I want it. That's where I want it.
Oh, okay.
That-
Should I lay my legs
Knees bent.
flat?
No, knees bent.
Oh,
Knees bent.
knees
You're
bent.
doing good. Yeah. Let's see if we can handle that a little bit. Okay. Breathe. Mm-hmm. It's an emulation of my elbow, right? You get the idea? We're trying to make an emulation of my elbow. They made a piece of foam. This was for the neck, but for you to alleviate that right leg pain, we need this guy. What you'll do is you'll have the wall straight. Let's go to noon. Let's try noon. Now, if the wall was here, you'd have your arms up against the wall. You get the idea? And you use the distance from the wall to start getting the arms lower and lower, right?
Mm-hmm.
Let's try. And you want to go to the edge and back off. If it's too painful here, then you understand?
It's not painful.
Okay, well then see how far you can go.
The left is the one that's
Restricted.
sort of trying to pinch a little bit. But
Pull, you have something, pull, and then stretch them back. But yes, you need to work all these angles. Like there's some spot in here, you'll find where the restriction is, like right here.
mm-hmm.
Let's say I'll let that one go. You might have to,
I have yoga.
you have your arm
balls.
propped up like this, you understand?
Uh-huh.
And then you try to, your goal over a period of months is to get these arms flat to the floor,
Okay.
right? And there's too much pain, you go
Back to
back over here. But yes, you need to, all of these angles, stretch the shoulder back. You press, get the head to sink in, and you can do a little bit of left.
Okay. I'm kind of not feeling any stretch at all, though. I'll show you if I do a stretch. Oh,
Good.
it's like not even hardly at all stretching.
Well, if you're used to it's mild compared to one of those weights you've been using, where you have the head back and you're putting weights on.
I haven't used those in several years. I just brought them
Well,
for fun to show you.
What I want you to do is I want you to do 20 minutes. We're going to test it out. I want you to do 20 minutes and see if your back of your neck goes tingling. At your tolerance, right? And we want to ride the wave of your tolerance. Add too deep, then we go.
Let me see if I can do more.
I don't want you to go far in that. I don't want your head just hanging there.
So I'll do the yoga block. At
Now, here's
home.
one block. That's a smaller block.
Okay.
But I want something behind your head
Okay.
until the head can lay flat without making the neck overbend. Right?
Now I'm kind of.
Yep.
Am I going up or
Yep,
down?
yep. Either way. The whole chest. Oh, I know.
Oh,
Oh, boy.
yeah.
Yep.
That's where the dinner roll was.
Yes, ma'am. You got it.
Am I going too fast?
A little bit, but it's okay. I'm happy to just show it to you today. The goal is you move 1 minute per inch.
Oh.
1 minute per inch.
So I was going to show you what I was talking
Sure, let's do
about.
it.
I usually do it this way.
Yeah. Okay. Look at you. Look at you.
Oh.
Yeah. Impressive.
That's really impressive.
Yeah.